Hi, we're Nia and Marianne from Seren Health Coaching. We are metabolic health coaches who are passionate about good metabolic health for everyone. We also love to chat about all things health and to share as much information as we can with people who want to make changes to their lifestyle but aren't quite sure where to start. We're going to release a new episode every fortnight on Fridays where we talk about a different aspect of health. So do subscribe and let us know what you think. We'd also love to know what you're interested in too, so if there's something you'd like us to have a chat about, do send us a message and we'll do our best to cover it soon. Do check us out at our website www.serenhealthcoaching.co.uk or find us on Instagram at Seren Health Coaching. Hello, what are we doing today?
I've been delving into the world of AI in healthcare. And I tell you what, it's mind-blowing stuff and really exciting. And some of it, as I'm sort of older than you, some of it's probably pretty normal for you. But yeah, some of it isn't so normal for me. But I think there's a whole new world and it's not coming, it's sort of come. And I think it's really, really exciting.
So why are we interested in AI in healthcare?
I don't know. Somebody I met recently was doing a lot of work on AI in healthcare, looking at future career opportunities, and I thought that was quite interesting.
Yeah.
And talking about how the benefits, the pros and cons of AI.
Interestingly, I saw a job for training an AI
Did
to
you?
give medical responses. So they wanted graduates,
Yes.
medicine, pharmacy, nursing graduates.
Right, there you go. So they're building the models.
Yeah,
Personally, if I was
and
young,
fact
I
check
would
it.
have my eye on the ball for getting into AI because I do think there will be room for all sorts, but it's already there. It's up and going, even in the NHS.
Well,
Believe
did
it or
you
not.
know that ChatGPT has ChatGPT Health?
Well, there you go. Is it
I
is it UK based?
ChatGPT?
Gee, yeah.
No, I don't think so. But you can go onto the specific health part of ChatGPT, and you can put in your symptoms. I tried it out
Yes, yes, yes,
just for research,
yes,
and I said, right, this is what's wrong with me.
yes. Did you
Tell
get
me
a
what.
good response?
And yeah, actually, not bad. I was quite impressed.
They're piloting it with S111.
I think it's what it is useful for in that kind of respect. And I
Mm,
have read. I mean, I don't know
mm,
how true these are, but I have read that if you put your symptoms into ChatGPT and you put everything in, because sometimes doctors can't pull from other diseases, and so they sort of
mm,
have a host of
mm.
symptoms they're looking for, and then other sort of outliers. But what AI can do is use those outliers
Yes,
and search on a
yes,
broader field than a human can,
yeah,
with a limited range of experience. And people have had diagnoses that they wouldn't have otherwise
yeah,
had.
really
So
interesting.
that's quite interesting, I think.
I think it's very interesting. I remember when, out of hours, I mean, this is before your time, but
Mm,
out of hours was set up for GP practices
mm,
that no longer did their own out of hours. And they used the very basic sort of algorithms and used non-medical staff,
mm,
and it was really pretty pitiful
mm.
because you had to go through it was a phone call, and you could
And
hear
that's the bit where they have to say,
the clicks of the algorithm, yeah.
are you
Are
bleeding
you
profusely?
yeah, is your child vomiting coffee grounds? You know?
Yes.
It
And
was and you just endlessly on and on.
yeah, and then the parent on the other end of the line is like, "What's coffee ground
Yeah,
vomit?"
why would they
Yeah,
have coffee ground? They've never had coffee.
coffee.
Anyway,
Yeah,
it was
yeah.
but having delved more recently, I tell you what, I'm really convinced that there's so many upsides for
Mm,
making healthcare more efficient, more accurate, faster, more effective.
okay.
Someone was talking about the lack of empathy, which of course is one of the problems
Yeah.
because robots or
Known for
systems
their
aren't
empathy, robots.
terribly empathetic. Although I'm not so sure you couldn't make a robot empathetic, but I might be wrong. But it might be the price worth paying
Mm.
for the extra efficiency because, I mean, there is some really good data.
Yeah.
But first of all, what is AI? I thought we should just clear this up because I had a bit of an argument with my other half about what AI is. And
Oh dear.
AI is a branch of computer science that develops systems capable of performing tasks that are typically required human intellect, such as
Okay.
recognizing patterns, making decisions, solving problems, and understanding language. So
Hmm.
it's not. So there's a lot it's not.
Okay.
So it operates on analyzing data through algorithms rather than relying on explicit manual programming for every action, right?
Okay.
So a
Right.
calculator isn't AI,
No,
obviously, because it's not making any decisions with the data it's giving you. It's just
it's just
calculating
facts.
something, yeah.
Yeah.
But if you're asking a system to make a decision from collecting that data, that's AI. So if you're asking a program to screen mammograms
Yeah.
and make decisions about what is normal and what
Yeah.
isn't,
And what needs
um,
further investigation and what
exactly,
doesn't.
that is
So that's,
AI. So
yeah.
so
Yeah.
it's
Fair
very
enough.
clear. Having said that, these things run sort of symbiotically, really, because technology
Yeah.
develops, and so
Can I
it's
just ask you a
sometimes,
quick question?
yeah,
Have you watched the most recent Mission Impossible films?
no,
No. They're about a
I,
dangerous AI that is trying to take over the world.
mm,
So they were both really good films, so I think you should watch them. But also, it's just fascinating because it's like a rogue AI that is really dangerous and
yeah, and that of course is the other side
is
of
the
all
kind
of
of,
this,
yeah, the other
and
side of
it
the
does
coin. Yeah,
feel when you're reading the stuff, even in healthcare, it does feel like it's really running away, that
yeah,
it's
because it's so
going so
fast.
fast.
Yeah, you never know actually which one is the right one to be using at which point because
It's
they're
already
all
gone.
it's already gone.
The
Yeah,
one you
the
were
one you
thinking
thought
was
was,
quite
yeah,
clever is already gone.
already been surpassed.
I looked up whether there's anywhere in the world that is running an agent, they call it in China, hospital. So a
An agent
digital,
hospital.
yes, it's a project. It's called the
Okay.
Agent Hospital. Really interesting. And it's the
Mm,
world's first virtual hospital project, launched in 2024
mm.
by a university in China, and it operates in a virtual simulation environment. It's a
Okay.
project, it's not a physical building, and it's not treating human patients yet, but watch the space.
Could do.
And
Yeah.
they're currently using it to train AI agents to self
Mm,
evolve, meaning, a bit like you were saying about the job,
yeah.
you would evolve that program because you would answer the same question, and
Yeah.
eventually you would evolve to the next level, if that makes sense. So the decision making gets finer. So they're improving diagnostic skills, and it serves as a safe, risk free virtual environment for training medical students, which I thought was really
Mm.
interesting.
Fascinating. I just looked that up because I wanted to know more about it. And it said these AI doctors handled over 10,000
Yes,
virtual patient cases in just a few days, which would take a human doctor nearly
2
2 years.
years, yes.
It's
So
mad.
this is really exciting stuff. Obviously, this is, a level up. But
Yeah.
then I looked, are there actual is the NHS doing anything? And yes, they are.
Yeah, the NHS are using AI. Yes. Yeah.
So if I said to you, what AI are you thinking about, if I ask you what the NHS is using, what would you think
Well,
of?
I know that it wouldn't be GP practices and repeat prescriptions. I can tell you that.
There is some work going on in GP practices, but no, I think the first bit that I remember seeing and thinking that's fascinating was the screening business, so
Yeah,
mammogram reading.
I think imaging
Yeah,
and
so
diagnostics
imaging.
is probably the most obvious place where you would use that. I
And they've
mean,
been using that a while now, and there's really good data. And I was
yeah.
thinking about older people like me walking into an X-ray department,
Mm.
and the receptionist could say, "Would you like our digital system to read your X-rays, or would you like an experienced radiologist?" And most
Mm.
people over 70 now would say, "Well, I'll have the radiologist." But
Yeah.
actually, there's really good data that the
I'd
other
have both.
system. Would you? Yeah, you see,
I'd
too
say
clever.
I'd like both of you to have a look at it
Too
actually.
clever. But there's great data
Mm.
that actually these programs are doing better
Mm.
than the radiologists. So there's
Mm.
less false positives. If we're talking about mammograms, there's less false negatives, and they outperformed radiologists. So maybe you don't use them for everything, but if you think about it, these are huge screening programs. I mean, they take
Mm.
enormous amount of people time.
Mm.
So, and they're very boring, very repetitive, and
Mm.
they usually have 2 people. I don't know whether the second person randomly checks, but anyway, they usually have
So
a
it's like
second human
routine
to
screening for like
cut yeah,
mammograms,
yes,
and what else do we
and
do
some lab
that's
stuff
routine?
like cervical smears, that sort of thing, where there's a huge volume. But even
Mm.
if AI just began by eliminating all your normal results, it radically cuts skilled radiology time that you
Mm.
could use much more productively and improve working lives too, and things like burnout, So there's
Mm.
it's just a no-brainer
Okay.
to not
Yeah.
use these. Okay.
What else have we got?
So, and then yes, then I looked a bit further, and the NHS is out there, and they're starting to pilot some really interesting things. So they're implementing virtual wards and apps for specialist care to
Yeah. Oh, I
reduce
did know
waiting
about the
times.
virtual wards actually. Yeah,
Yeah,
that's a good
that's
thing.
quite interesting.
Didn't that come in COVID? Or I think it was
Yes,
before COVID,
maybe
but it was much more.
COVID made it go faster. I mean,
Yeah.
COVID made everything go faster.
Well, it had to.
You'll be so you'd come in from primary care referred by a GP, and you'd be offered the normal route or an
Mm.
online referral to specialists,
Mm.
who were virtual. They
Mm.
weren't virtual, but what I mean is it's a virtual route, and it
Mm.
would be much faster, and you
Mm.
would get probably better care that
Mm.
way. It will become so normal. There's an initiative at Alder Hey,
Oh yeah, in
and
Liverpool.
yeah, they're using all sorts of really interesting stuff,
Mm.
to support families, children, virtual assistants for families. They're used for scheduling reminders, symptom checkers, predictive analytics for early diagnosis and intervention, and a
Oh, that's good.
documentation tool, which I really liked, that securely records conversations between parents and clinicians and records notes for the patient's
Oh,
electronic records and writes letters to families based on the conversation it's recorded. But
that's so
imagine
helpful.
on your app that you could go in and re-listen to a consultation, because you
Mm.
know what it's like being in consultations. You don't actually hear
You don't listen
everything.
a lot, and also when it's your child, you're probably
Yes, all that.
your brain is doing other things and a
I
thousand
mean,
other things.
the
Yeah.
only minus for me would be that I chat a lot about other things, in my consultation. So that would be tricky to explain to the AI tool.
Yeah.
I
Why
didn't
is she
necessarily
talking about
want.
ice cream?
Yeah,
Yeah.
exactly. Anyway, I mean you could get around that, and but I also suspect that you very soon forget. It's become so normal, so
Mm.
it doesn't matter. I mean, your chat would be the same probably, because you use your
Yeah.
chat to relax people or whatever
Yeah.
it is that, yeah,
Yeah. I mean,
humor and all that.
interestingly, for all of my consultations and
Yeah,
coaching, is most
yeah,
of it, if the patient gives consent, it's recorded.
yes,
And because you're building rapport, aren't you? So
yes, of
you're
course. So
talking about random
exactly.
things, like somebody will
Yeah,
tell you that they're going on a cruise, and I'm like, oh, I'm so
yes,
terribly
yes.
sad for you. How awful. How on earth will you
Yeah,
cope?
yeah, yeah.
And the AI would
Exactly.
find my sarcasm quite difficult
No, I agree, but
to
you very
interpret.
soon forget it's recorded. So there's lots of interesting stuff out there, and triage stuff. The NHS 111 online systems using AI to develop a symptom checker initiative.
Oh, that's helpful
So
as well. Yeah.
yeah, and that'll ring alarm bells with certain answers, but it
Yeah.
cuts a lot of stuff
The
out that
dross
doesn't
out.
necessarily need
Yeah.
a personnel. And I was
Yeah.
just reading this morning, Bournemouth A&E, very new A&E departments just opened, and they're
Yeah.
running an AI-based triage system. When you
Mm.
go in, you go to a big screen and you book in, and it's
Mm.
signposts. So it's not even a person that signposts you.
The triage screen
20%,
does now.
yes, 20% of attendees to primary sends to primary care. So
Yeah.
they've lost
Good.
20% of people out that queue, and also they give them an appointment. I mean, where they find the appointments, who knows? But I presume there's a general a GP in the department, actually. I think that's what they're doing.
Ah,
They're
okay.
running a GP in
Clinic in
any
A&E.
departments, which is fantastic, really, because then all the ear infections and things can go that way.
Yeah.
And I mean, a
Oh,
lot of people go to A&E in this country because they can't get into their GP. It's not really their
yes.
fault.
It's not their
So,
fault that they're there.
no.
No, no, absolutely. Okay. Well, yeah. And then there's other things like design of medicines and
Yes.
creation of
So,
new
if you were a
candidates.
pharmacist, you're not now, but if you were, what would you
Mm.
think about AI in the world of
I think
medications?
in terms of like drug development, it's been used
Yeah.
for a long time because the human would identify the possible candidate
Yeah.
for the drug. So they would say, oh, this is the structure of the medication that we think, this is the chemical
Yeah.
structure that we think will work. And then they would run a simulation, and then the computer will give you like 20,000 different options. And then it will
Okay.
narrow that down based on parameters that you give it and then you try and make them. It tells you which ones are most likely to succeed in terms of
Yes.
stability of
So you sort
making.
of get into the place quicker
Yeah. So
in
instead
terms
of
of development of medications.
yeah, it cuts down the research and development time by years because
Yes.
once you know what you need to make
Yeah.
and that you've got a higher success rate if you make these
Yes.
compounds rather than these compounds,
Yeah.
then
I
you
mean,
get to the
why would you
testing.
not?
Yeah,
Yeah.
why would you not? Because you get to the testing part faster.
Yeah. Yeah. And
Yeah,
even
so
in the testing part, I presume that the monitoring would be so much easier because you give people an app and, they have to
they
log
could, yeah.
their,
Yeah, yeah,
I
yeah.
don't know, measurements or blood pressures or whatever you're looking for in terms of side effects. It could all be
Well, take for
logged.
example, I'm working on a clinical trial at the moment,
Yeah.
and a lot of the data that we collect for the trial
Yeah.
comes through participants logging information themselves on an app.
They
That's something that technology can be very helpful with. The
exactly.
technology facilitates that kind of data collection, but you also do need a human to go, ooh,
So
here's an outlier.
you're still running the show, but it's giving you shortcuts, isn't it?
I think
So
it's doing all of the
the dross.
grunt work for you,
Yes,
which is
yes, yes.
really important because actually
Well,
that's the
just
bit
good
that
for you too, because you don't get so burnt out by the
bogs
dross.
down in the data. Yeah, yeah, cool.
Exactly. What about COVID? I
I
mean, there
think
must have been enormous acceleration
I think there was
in the
a lot.
vaccine development, wasn't there?
Yeah, there was, I think, probably, a lot of the research that went into COVID vaccines and treatment
Yeah,
probably was helped by AI. And,
yeah,
and robotics and AI in itself did a lot over COVID.
yeah, yeah, yeah.
So yeah.
I hope they're looking at this new virus, the rodent one.
Oh, hantavirus, that's a bit
Yeah,
terrifying, isn't it?
golly. I mean, who's going to dock that boat? Anyway, that's not our problem.
No, they've done it now. They've docked.
Are they
Spain have let
docked?
them in.
Oh, good old Spain.
Yeah,
Not sure I would have.
terrifying.
Yeah, terrifying, because it's got a very long incubation. That's the problem. So if it was a short incubation, it'd be really easy. Keep them all there for a week and you're done. But
Yeah,
it's
but you don't
up to
know.
8 weeks, the incubation. Mm.
Oh, and it's
Anyway,
from.
not my headache, but
Do you think they'll just get rid of that cruise ship now? No one else will ever go on it.
yeah, well, yeah, let's not even go there. I thought, rather than just running through all these applications, what we do for a little bit of fun is pretend we can design something.
Oh, okay. Make
I
our
did a
own
little,
system.
yeah, I made a little sort of imagination run riot hospital thing. And then
Mm.
when I read all the stuff that's going on, I thought, well, actually, this is all going on anyway.
Yeah, that's true. Yeah.
But the one thing I did think about was getting patients in the UK. So we're talking about the UK because we live in the
Mm.
UK. Is
Hmm.
getting patients to hospitals because it's such a huge problem.
Yes. We can't. Yeah, unless you have a
We
car, you
can't
really
actually
can't get
get
to
the
the
patients
hospital.
to the hospital, and we
No.
can't park the cars when they get there.
Nope. There's no room.
The first thing I would be looking at is building hospitals where there's, absolutely fabulous public transport, because that's the first real hurdle
Yeah.
for people in this country.
Yeah. If you can't get there,
I
you can't get treated, right? So you need the first thing to be.
Yeah, exactly. And I've
Yeah.
seen so many people recently, because I've been with grandchildren and things,
Mm.
people driving around terrified because they're basically going to miss an appointment they've waited 18 months for. because they literally cannot park the car. And I
Yeah,
think that's
yeah,
so awful and a terrible way to start an appointment.
yeah, in
Um,
a fluster. And most
yeah.
people, panic that they're going to be late when they,
Well, let's just
yeah,
get the public transport systems attached to hospitals when you're developing a
absolutely.
hospital, where
Yeah.
you're putting it and how do people get there.
And then
And
once
years
you
ago,
get
I
there,
suppose it was pretty easy, but it isn't now.
I think demand on healthcare has surpassed
Increased.
past
Yeah.
availability, hasn't it? And
Well,
that's
it
the problem.
surpassed the systems that were set up for it. I
Yeah.
mean, the staff all
We
used to park at hospitals,
Oh
and
yeah, we
now,
had to pay though.
did
Came
you?
out of our wages
I
every
don't
month.
think originally we did, but there was parking space for staff, but there really isn't in most hospitals
No.
now. So that's the first bit I'd look at, and then you would book into this wonderful hospital. First of all, you'd get there, and
Mm.
there would be mobility scooters, motorized wheelchairs to get those people into the hospital. And you could have some really friendly robotic greeters, I thought, um, who knew who you were, that'd be
Mm.
nice, and said, "Hi, we're waiting for you, blah, blah." And you would use a QR code on your smartphone. I don't know what you'd do if you didn't have a smartphone, but let's not go there.
Well, this is the problem. There are
So,
issues now with people unable to access
yes,
services
and
because they
that
don't have
is
a
one
phone
of
that
the
allows them to do that.
downsides. But anyway, you've got your QR code, and a bit like going to get on a train in this country, you will just show it to the stand, and in you'll go, and you'll go to a screen and book in basically, and it will do all the pre stuff, the checks.
Mm.
So
Mm.
say our patient's going to have a hip replacement. This will be a day case, by the way, generally. So they'll
Mm.
book in early in the morning. There'll be no you won't have to sleep in the hospital. And on that screen, all those pre-appointment checks that have been done before will be there, and
Yeah.
it will then measure your blood pressure. It'll do all those, and it'll record everything. And it'll ask you, if you're nil by mouth and all that. So it'll pick up any sort of, alarm bells before you even get through the first bit.
Mm. Mm.
Then you'll get a little map it'll be digital. It'll be a light probably with a color, and it'll just say, "Follow the orange line to the department." Because that's another thing if you've been to hospitals recently. I
Oh, you can't
mean,
get anywhere. It's
well,
terrifying.
no, you can't
I
find any. It's absolutely terrifying because you
I
can't
had
find the department.
to take my dad to a different A&E
Yeah, yeah, that you didn't
because
know. Yeah,
that I didn't know.
yeah, yeah,
So anyway, I dropped him off at the door
yeah.
and went to park the car, and I got back into the hospital
And
and
yeah,
somehow
you couldn't
managed.
find him.
Couldn't find A&E. I went the whole way round and ended up somewhere else, and I was
God,
like, I'm sure I'm not in A&E, but this was like some kind of medical
exactly.
assessment unit or something like that. But I was like, I don't understand. How have I completely missed him?
You'd
And I
actually
had to
have to
retrace my
put a
steps.
tracker on him.
Yeah, so these kind of things are actually quite tricky to find.
Oh, they are. In fact, the hospital here, I use the outside now. It's an awful lot easier. So if you go around the outside of it, you can find the doors that goes to your department.
Oh, that's
Because if you're
clever.
inside,
You can't
honestly,
find
it's
anything.
just
Yeah,
no, it's just
it's like a maze,
corridors after corridors.
and they all look the same.
Yeah.
Yeah,
Anyway, these are the
that would
small
be
things
very
that would
helpful.
make
Yeah,
it more efficient, and also it's very stressful. People don't
it is.
understand.
When
It's
you don't
really
know where you're
stressful.
trying to go and
By the
you're on
time
a
you get to
limit.
the department, you're half dead.
Yeah. And the other thing is obviously if you've got mobility problems or you
Yes,
can't walk that far or you've got to go
yes,
up and down stairs,
all
it's a
that.
really stressful time to be able to
Really
get to where you need
stressful.
to be. Yeah. Yeah.
Exactly. And you think you'll miss your slot.
Yeah. All of
Um,
those things. Yeah. Okay. Fair enough.
okay.
That sounds good.
So how would you get to this joint replacement? I mean, you've got your appointment and you're in now, but you would have been referred via a GP. Um,
Yeah.
and it wouldn't have gone by fax, by the way. Um, and you would
Although
have
we do
got
know that fax machines still exist and are
we
used in the
do,
NHS.
we
So,
do. But in your GP practice, you already have got a lot of the preamble. So
mm,
lifestyle advice, health coaching in every surgery, yes, where they would optimize how well this was going to go for you. Because
mm,
we all know that optimizing weight management and exercise can circumvent the need for surgery altogether, but it can also make the outcomes
Much
of
better.
surgery
Yeah.
so much quicker, like your recovery and everything.
Yeah.
So,
Yeah.
and the orthopedic department will have organized an MRI or whatever imaging is best, and they would have then booked a Zoom consultation with you to discuss options for that joint replacement. So it's all lined up, and on your records would be that 3D preoperative plan generated from the imaging.
Yeah.
So now
Sounds
you
great.
get to the surgeon. You would meet the surgeon and the anaesthetist in person.
Oh, good. I'm glad we
I
know who
thought,
they
yeah, I thought that
who's
would be
operating on.
nice.
I
And
think
they
it's
would
nice to know.
check your consent just to make sure that, and they would check all those details. But they would also check the consents that you understood.
I imagine that it would be very helpful though to have had the computer to go through all of those things and
Yes,
then flag up,
yes,
okay, we don't have, I don't know, the
exactly.
latest repeat prescription
It would
or
ask you on that screen, it would say, "Do you understand, or would you like to discuss further, or whatever?" It'll have little alarm bells for gaps where somebody doesn't really understand what they're doing, because people do land up in hospitals not understanding. And the actual surgery, they do, I mean, hip replacements as day cases now, it really boggles my mind, but they use a robotic arm. So you've still got
yeah,
a surgeon, but he uses a robotic arm to
for
assist
better
for
margins and
precise movements based on those 3D images.
yeah.
The outcomes are so much better because you have less pain, faster recovery, and that joint is almost individually measured for you.
Yeah. I remember going to watch some surgery.
Yeah.
And orthopedic surgery is brutal.
Yes, it's brutal. Yeah, you get the
Yeah.
toolbox out and they
Well,
start
yeah, and like the
hammering
hammer and
about.
yeah, and
Yeah.
it's a
So
really
they've got
scary thing.
a new way of doing it. It's really interesting. So you go between the muscles and the nerves. It's incredibly clever. And then going out that evening, all being well,
Yeah.
you'll have virtual health assistants, chatbots. So you'll have been prepared, by the way, before by the physio and the occupational therapist that you met in your general practice. They would have looked at where you're going home to, who was around to help, what sort of physio you might. They would have prepared you. So
For all
that
of
makes it a lot easier. And there's now uh, apps that interact directly with patients. So
Yeah, so then you've got all that
you won't be
technology
on
that
your
we
own. Yeah.
yeah. So you
They'll
can go
monitor
home
you.
with a blood pressure monitor that will feed straight
Yes,
back into your
exactly. They'll monitor
records.
you. You'll have smartwatches, predictive analytics where you can work out if somebody's going off, as we used to call it. So
Yeah.
someone
If they're
with
going downhill rather
an
quickly, yeah.
infection or something where their
Yeah.
heart rate's getting faster and their temperature's going up, all that stuff will be in there.
Mm.
And but the ones that are doing fine will not be requiring the resources, if you know what I mean.
No.
So you will
I
have
think it's a great way
targeted
of
your
increasing
resources.
increasing availability to these kind of things by
And
yeah.
your social care will also be more targeted. So people who don't have meals, things, personal care can all be built into that system.
Mm.
So that's sort of my imagination. There is still a person in there
Yeah.
or two.
I think that's really important to have. So one of the things I think about AI is that it's very clever, yes. It can
Yes,
be very helpful, yes, but it
yes.
always requires a human oversight. Because with
So far it does. Yeah.
yeah, but I think actually that makes people feel it is safer. Because if a
Yeah.
human has looked at it and objectively said, I'm not just going to take everything at face value, I am just going to double check.
Yes.
Because
Yes.
mistakes can still be made. And remember, it is
And
a
have been. Yeah,
yeah, and have been.
exactly.
And I think particularly with people's health, we need to be we can trust some things, but we can't trust everything. And I think a healthy
Mm.
level of skepticism, in the
It
same way
yeah.
as we are healthily skeptical sometimes when we do see patients and we don't see the
Yeah.
results we should see, and we think, well, why is that happening?
Yeah,
We
yeah.
can't believe
We
everything
keep
we read.
open.
Yeah.
Yeah, it's interesting. So AI can do that, I think, um, at a quite sophisticated level,
Mm,
but it's in its infancy from that point of
mm,
view. So
mm.
they're layers, I think, basically.
Yeah, I think it will get more and more
Yeah, it will. It will get
effective
more
as we go on.
sophisticated
Yeah.
and more effective. And it'll
But
flag up.
obviously, I
Flag up
don't.
stuff much better than humans, I can
I,
tell you.
yeah, but I do not want the AI to tell me that I've got cancer. I want a human to tell me
No.
that.
Yes,
And I
interesting.
want, if I've
Yeah,
got to turn off life support,
yeah.
I want a
You wanna
doctor to
talk
come
to a
and say,
person. Yeah,
like, I'm really sorry, your relative is very
yeah,
poorly.
yeah,
And
yeah.
I
So
I
we're
don't
not
think there's.
talking we're not
Yeah,
talking about replacing doctors or nurses. We're talking about making their lives less tedious, really, and, stopping the burnout that's happening hugely
yeah,
in
yeah,
healthcare.
and helping them to do their jobs more effectively and
Yeah,
efficiently,
and with
which is
more
important.
sort of job satisfaction.
Yeah, definitely.
So there are limitations.
Yeah.
Data privacy is one huge concern, security of data. And,
Mm,
a lot of people still don't like even putting their using NHS apps for that
mm,
reason.
mm.
I'm less bothered about that, but I think I haven't got data that I would be bothered about anyone having actually. But of
I
course,
don't really care.
there is that. There's bias on algorithms, so
Yeah,
that can affect diagnostic accuracy. There's regulatory and ethical issues, and I think they are huge. And we don't even know all of them yet. I think they'll
yeah,
slowly appear.
yeah. I think the biggest problem that we possibly have is the ability of an AI to hack
Yeah.
and get data out. So
Mm.
it's keeping people's data safe is one of the biggest things.
Yeah, yeah, yeah. And the lack of empathy of digital
Yeah,
systems.
yeah. And then people who refuse to or cannot engage
Yeah,
with digital
yeah,
systems,
yeah.
which means that they are discriminated against.
They
So
are.
that's not
And
on.
that'll get less and less of an issue as we go on because, even in my age group, there's a fair amount of technical
We
knowledge
did.
now.
Yeah. Yeah,
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 but
definitely.
and so they'll go over the top. But it
Yeah.
also means that everyone has to have, I mean, a smartphone or whatever the criteria is for using. I mean, to use the NHS app, I suppose you don't need a smartphone
You
actually. You
do.
just need, do
Well,
you?
you have to have the app.
You
So you
do,
have to have,
yeah, yeah, yeah.
yeah.
Okay,
You
because
can
you
do it
got
on a
to
tablet. But
download the app. Yeah,
yeah, I mean, it's a good app.
yeah. I think it's great personally.
Yeah.
I love I love being able to reflect on my, blood results or
Yeah, me too. I
look at
like
a
going back and having a look
consultant's
at my
letter
stuff.
or,
Yeah.
yeah, and remind myself about, I like that. And also see trends, which I
Yeah,
also
that's good.
like. Although I
Yeah.
did ask my GP recently if they like the patients coming in with all their blood results, and they said no, frankly,
Mm,
because people misread them
mm,
and
mm,
takes longer to unravel. So,
mm.
old days, the GP said, "Oh, yes, your blood results are all normal, dear." And that
You
was the
never knew what
end.
they were about.
No, it
Yeah. But then,
was an awful lot quicker than trying to explain someone's LDL particle
yeah.
size.
But this is not patient focused care. So,
But if you're working this, it's hard. It's hard. So that's quite interesting. But I think
mm,
all that will get better. So you're not replacing doctors, but you're getting much faster, more accurate diagnoses in some
mm,
areas, which
mm.
and earlier detection of disease, which has got to be a good thing. I did ask my lovely daughter-in-law if she was a bit worried about her clinical job, whether she thinks that AI would take over one day, and she said,
Mm.
"Well, when we've got an NHS computer system that works, and have centralized patient records and
Mm.
phased out the last of the fax machines that are still in
I
use in
believe it when I
three
see it.
NHS
Yes.
trusts, I'll worry about my job." Yeah,
I agree. I mean, look,
yeah, it's a long
we've
way.
all worked with NHS computer systems. They are far from
Oh,
easy.
how much money, anyway, let's not go there, have they spent on trying to sort out the NHS computer systems?
And how
It's
often does it
vast.
go down? And-
It does strike you that the more sophisticated these systems get, the more
Mm,
tricky it is without them. And we
mm,
see that now, don't we, in everyday life
mm,
quite often, whereas years ago it would have been a minor blip. It's
mm.
now a major blip where, I don't know, when there was a fire, wasn't there, at Heathrow? and
Oh,
caused
yes.
absolute mayhem for
Yeah.
days and days. It's that sort of thing. It's here to stay. It's fun.
Yeah.
It's really interesting, and I'll watch with interest how it maps out, and the benefits of it will be huge. Right. See you soon.
See you soon. Bye.
Bye for now.